Today we're going to have a very candid discussion about childhood cancer. Cancer has recently been a topic of discussion in Kenya, and today we'll have a specific focus on childhood cancers. About 3,200 children are diagnosed with cancer in Kenya every year. However, this is just a tip of the iceberg. We have on Wanja's Health Diary today Professor Jessie Githanga, who's a hematologist and specifically treats cancers related to the blood in children. Karibu sana, Prof. Tell us about childhood cancers. What are the childhood cancers, and maybe we could start with the age range of which qualify to be childhood cancers.
We often consider children anybody between the ages of from birth to 19 years. Unfortunately, most of the times in the hospitals, you find that whenever a child reaches 13 years, they're then shuttled into the adult wards. But internationally, it is recognized up to 19 years. Some countries even go further. You're still a child. Now, the common childhood cancers that we see in Kenya are the blood cancers or blood-related cancers. That includes leukemia, where your white cells, that's a special type of cell in the blood, becomes malignant, and that's what they call the blood cancers.
All right.
Then we also see the lymphomas. That is when, the lymph glands, you're familiar with the lymph glands, when the cells in those turn malignant and they cause a swelling, and the swelling can be in any part of the body, very often is in the lymph glands around the neck, under the armpits, or it can be in the abdomen, in the stomach, or on the face, where it can cause swelling of the jaw.
In terms of the cure rates, what percentages are we looking at in childhood cancers?
Unfortunately, in Kenya and most of the low and middle income countries, the cure rates are still very low. In Kenya, we're talking about anything about 19 to 30%, whereas in high income countries, they achieve 80 to 90% cure rates for their childhood cancers. So that shows you that childhood cancers are very curable. However, they have to be diagnosed early and appropriate treatment has to be given. Yes.
And as we talk about early diagnosis, what are some of the symptoms that as a mother, a caregiver, a teacher, or even somebody who's close to the child that they can look out for and say, this is a probable pointer to a childhood cancer?
Yeah, and there is a myth often that is given that people go late, and that's why the childhood cancers are diagnosed late. But very often you find the mother has detected there's something wrong with the child and presents to a health practitioner in a facility, whether it's a health center or middle or upper level hospital. Very often these health practitioners may not recognize that this is childhood cancer. So because many of the signs of childhood cancer are very non-specific, they may mimic a condition like tuberculosis or typhoid or pneumonia, etc. So for a parent, we usually advise if your child has either a cold that does not seem to be getting better, and the child seems to have no energy. If it's a child who was active, they're now not active. They're just sitting somewhere. They don't want to play anymore. They're sickly, and when you take them to hospital, they don't get better. You take them to one place, they're given medication, they don't get better. That can be a sign of childhood cancer, especially like the leukemias or the blood cancers, because those can present like many other diseases, but they will note that the child lacks energy. If they look at the tongue, which is usually pink, it may appear whitish. That's because the child is lacking blood. The child also is prone to getting frequent infections. It can be either pneumonias or tonsillitis, or even skin infections like fungal infections of the skin, etc. and the child also will have a tendency to bleed. It can be either bleeding from the nose, bleeding in the gums, and even on the skin, the child may be seen to easily bruise. Children with blood cancer often complain of bone pain. And the pain, they say, is quite intense and in all the bones, so that the child may stop wanting to walk and may only want to sit down and not play.
All right.
For the other cancers like the lymphomas, the parent will notice a swelling. A swelling may be either in the neck, or it can be in the stomach, or even on the face, on the jaw. And this swelling, even when the child goes and is given antibiotics or other treatments, it does not go, it just progressively gets larger. And then there are kidney tumors, where the abdomen will be seen to be progressively enlarging, very often noticed by the carer when they're washing the child, because those kidney tumors usually occur in young children, usually less than 3 years of age. And then there's the eye cancer, known as retinoblastoma, where the mother will notice white color. Instead of where the pupil is supposed to be black, it seems like it's white. There's something happening. And one program that was very innovative in one of the South American countries is they asked their mothers, take a photo of your young baby. And when you take a photo, we usually notice what we call the cat's eye, looks reddish, that funny look. If a child has that eye cancer, you will not see that reddish color, you will see a white color. And they told parents, if you see this happening, contact this hospital and the child will be taken care of.